Hi, I'm Madhulika. I'm from first year. I'm from Andhra Pradesh. Today I'm going to talk about skull. Brain. The skull consists of two parts. One is visceral side and one is neurocranial side. And visceral side, as it is sense organs are there, so it is visceral, and cranial as the brainial crane nerves are there. And when we talk about the structures of visceral side, anterior aspect of the skull. Anterior aspect, this is the frontal bone, and here we have orbitals, and this is supraorbital sinus we have, and inferior orbital suture, and this is nasal cavity. Here we have inferior nasal conchae, and this is zygomatic bone, zygomatic maxillary structure. This is mandible maxillary structure, and this is the inferior aspect. Here this is palatine bone, and this is transverse palatine structure suture, foramen magnum.
Hello everyone, my name is Vikas Kumar Singh. I am from Bihar, and here I study in Bukovinian State Medical University. I am first year student, and I am going to explain this humerus bone. This humerus bone is divided into three parts, and this one is proximal end, this one is sap, and this one is distal end. If we talk about the distal end, there is a posterior surface and anterior surface. There is a radial fossa and coronoid fossa. And if we talk about this shaft, this is divided into two parts, upper and lower. The upper half is rounded and the lower half is triangular in shape. And this one is the proximal end, which is attached with the scapula of the glenoid cavity, and there is a head of humerus. There is anatomical neck, surgical neck, and
Hello, I'm Ashish and I am from Kerala. I'm a first year student in Bukovinian State Medical University. Today I'll be explaining about thoracic vertebrae. So the vertebral column consists of 33 to 34 vertebrae. It consists of the cervical vertebrae, which are 7 in number, thoracic vertebrae 12 in number, the lumbar vertebrae, the largest vertebrae of the lot, which is 5 in number, and the fused sacral vertebrae and the coccyx. So I'll be explaining about thoracic vertebrae. Thoracic vertebrae are mainly known for their attachment of the ribs. So thoracic vertebrae are the second largest non-fused vertebrae. They are 12 in number. They represent the cervical vertebrae at the top, and coming down towards the lumbar vertebrae, they show characteristics of the lumbar vertebrae. So speaking about the thoracic vertebrae, the main difference of the thoracic vertebrae as compared to the cervical vertebrae and the lumbar vertebrae are the costal facets. There are superior costal facets and inferior costal facets, and also transverse costal facets. These are required for the attachment of the ribs. So there are complete costal facets and there are demifacets. The function of demifacets is that the inferior demifacet of one thoracic vertebrae and the superior demifacet of the next thoracic vertebrae joins together, and the head of the rib, which has two articular facets, joins to these two vertebrae for the articulation of the ribs. So speaking about the structure of the thoracic vertebrae, they have triangular shaped three-sided spinous process. They have a transverse process. The transverse process has a transverse costal facet. They have a superior and inferior costal facet. Coming down to the 12th thoracic vertebrae, it has the transverse process is divided into two types. It's a superior mammillary process and an inferior accessory process. And coming to the usual characteristics of the normal vertebrae, it has a superior inferior notch, superior and inferior articular notch.
Hello guys, my name is Mir Jadhav. I am from Vadodara, Gujarat. Here I am studying in Bukovinian State Medical University. Let's talk about heart. Here the heart derives from the mesenchyme of the notochord. Here there are four chambers, the right and the left. In right chamber there is a right ventricle and right atria, and in left chamber there is a left atria and left ventricle. If we talk about the heart, the right side is for the deoxygenated blood, while the left side is from the oxygenated blood. Here the contraction of the heartbeat is originated from the cardiac cell, which are exclusively found in the heart. Here, if we talk about the contraction process and the originating of heartbeat process, then it is originated from the AC node, which is called as the pacemaker of the heart. From AC node, it passes to the AV node, that is auriculoventricular node. From AV node, it passes to the bundle of His and then to the Purkinje fiber. And then if we talk about the heart, the deoxygenated blood come to heart from the pulmonary artery and then went out to the aortic vein. There are also valves from this aortic artery and the vein to prevent the backflow of the heart. Here the ventricle is more thicker than the atria because the pressure under the ventricle is more than the atria.